have been on Zoloft for about 3 years now. I decided to taper off of it back in June. What recommendations do you have to support the gut and the brain after being on an SSRI for so long?
So weaning off SSRIs, it has to be done, in my opinion, with an expert that's trained in tapering.
After eating sugar, I will get a sore throat.
There's studies that show that having over 50 grams of added sugar is associated with a 2 times increased risk of bacteria that triggers recurrent pharyngitis.
When I have gone into calorie deficits the past 2 times, I've lost my cycle both times.
Hypothalamic pituitary ovarian axis, the HPO axis. What's up and welcome to the Art of Being Well. We're giving away some free healthy stuff for everybody that's into health. Hopefully you are if you're watching this podcast. We're giving away free signed books. You can pick which one you want. We have 4 at this point: the inflammation spectrum, ketotarian, intuitive fasting, and gut feelings. We're giving away free telehealth consults with the team and I. And we're giving away free supplement protocol stacks that we have at drwillcole.com. We have hormone support, gut health support, brain health support, anti-inflammation, like lowered inflammation. Anyways, you can see which ones you want. It's the Art of Being Well supplement line. And for a chance to win, how can you win one of these things? You head on over to Apple Podcasts. Very simple. And rate and review the Art of Being Well there. Tell us what you love about the pod. I'm sure it's a lot. It's going to be hard to pick, but just pick 1 or 2. And then you can you could either leave your Instagram handle in the Apple Podcast review itself, or take a screenshot and message at the Art of Being Well _ on Instagram. And Brooke, who's my lovely podcast manager, she will go through the messages on Instagram, and then I do read all the Apple Podcast reviews themselves. And then Brooke will randomly pick winners and then reach out to you, and you can tell us what you want. And good luck, guys. I hope you win. I hope you win. Yes, you.
Yeah, we're coming for you in the best way possible.
I see you. I want you to win. So to help me out, every Ask Me Anything episode, we have 2 brilliant members from my clinical team. They help me on the patient side to optimize people's health, to get to the root cause of why people are struggling. And we've been working together for close to 10 years, 16 years.
Yeah, long time.
We're the OGs in functional medicine. All the rest, imitations. Let's just be honest. So yeah, Andrea and Emily, what's up?
Hello. Hey, what's going on?
All right. So to submit questions, I'm loving this SpeakPipe. I'm loving people submitting a voice message so we can play it on the Ask Me Anything episodes. To go there and to leave that voice message for me for these episodes, go to speakpipe.com/drwillcole. That's speakpipe.com/drwillcole. speakpipe.com/drwillcole. And then leave a voice message. The questions can be about your own health issues that you're wanting a perspective on, things that we help people with clinically. It could be about a wellness trend you saw on social media that you want. Is it hot or not from our perspective? Or is it some research study you heard in the news or read in the journals and wanting to know what's the context of this from a functional medicine perspective? Anything and everything. You can do it. You can do it all. You can let us know. You can ask us
anything.
The most random. Sometimes we like random weird questions. And people send in some random weird questions.
100%.
Even our patients ask us random
more
weird
the better.
questions.
Come one, come all. You are welcome here. All right, let's get into the first one.
All right. So our first question is an anonymous question, okay?
Oh, anonymous. Dear Delilah.
Hello, I have been on Zoloft for about 3 years now. I was on it for anxiety. I decided to taper off of it back in June, and I'm getting really close to being completely off of it now. My question to you is, moving forward, what recommendations do you have to support the gut and the brain, or just your health in general, after being on an SSRI for so long? I appreciate y'all's help. And P.S. I am not Heather.
That's amazing.
Thank you, not Heather.
So this is an avid listener of the podcast. So go back and listen to it wasn't last episode, it was a couple episodes ago where I kept calling all the people that left a voice message for the show Heather by accident. Like my brain was just like, I think that she said Heather. We made a joke out of it and saying, look, you have to be Heather to submit a question, which you don't. That was so funny.
That was
awesome.
I actually really enjoyed that. Thank you, Anonymous, for my laugh for today.
So weaning off SSRIs or really any brain health, antidepressant, anti-anxiety, whatever class of medication is what I'm trying to say. It has to be done, in my opinion, with an expert that's trained in tapering. And look, people can make whatever health decision they want and try to do it on their own. That's their body, their choice with this. But I would recommend it as a general rule to have it done appropriately and under the guidance of a doctor that's trained in tapering. But it seems like she's having great success with it. Typically, a tapering, I actually talked to a brilliant person in this space named Brooke Seam. If we could put it in the show notes, Brooke. Brooke Seam, which is not the same Brooke as my podcast manager, but Brooke Seam is just, the conversation we have is wild as far as that world of antidepressants, antipsychotic medication, benzos, and the tapering world and what she went through. So I would say a companion episode to this question would be that episode. I really liked it a lot. Anyways, it's typically, what tapering looks like is typically 10 to 25% decrease of the dose of the medication over the course of months.
Yes.
Really, it can take time. Brain zaps can happen in a pretty significant percentage of people. Digestive problems can happen because it's modulating the gut-brain axis. It's modulating the nervous system in a way, in a significant way. So you have to do it smartly over time, and it has to be very gradual over time to allow the body time to adjust. There's even, you could do, some doctors that do tapering will switch to other antidepressants at the same time that have a longer half-life. So basically buffer the decrease of the other medication that maybe they want to get off of. But certainly you can do it naturally. And certainly I want to empower people if they feel intuitively they want an alternative, and working with their doctor, I think it really can be a great healing process to deal with the root causes of why they have anxiety and depression in the first place.
Yes.
So what are some things that we would do in a protocol like this? Some examples, because there's limitations to what the questions she's asking.
Yeah.
We have to look at her labs, her health history, and the context of it. So the scope of a podcast is not that. This is not replacing you being a telehealth patient or you working with a doctor locally. And but some ideas would be things to modulate inflammation, like bringing in good things like boswellia, curcumin, even omega-3 fatty acids. A lot of good science show sort of the brain neuroprotective benefits of that.
Yeah.
I'm a massive fan of saffron.
Yes.
A massive fan of GABAergic and serotonergic, these sort of compounds that work on serotonin pathways and work on GABA pathways, even acetylcholine pathways. So it could be different compounds and minerals like magnesium, L-theanine, GABA has its place. What am I forgetting? Phosphatidylcholine.
Yeah.
Anything else?
No, you named a lot of stuff. And I do want to point out, we do have this specific blend on our Art of Being Well line. We have the gut feelings supplements for a reason.
Yes, you're right about that. So gut feelings, I formulated that and it launched whenever my book Gut Feelings, which is also a good companion read if you want to look about the vagus nerve and the gut brain axis and sort of the crosstalk between mental health and physical health. And things like chronic stress, unresolved trauma, which also should be integrated in, like you're talking about, like nervous system dysregulation, somatic practices, vagal nerve stimulation. I mean, these things need to be brought in. Now, look, I just named a lot of stuff. Do you need all that stuff? Not necessarily. You maybe just pick 1, 2, 3 of them. We're talking about a psychotropic medication, an antipsychotic, and that's modulating biochemistry pretty significantly.
Right.
So to bring apples to apples, you sometimes need some more tools within the toolbox.
Right.
Yeah. I'd almost even suggest at least 1 to 2 from each category. Somatic, So you're doing like the physical components, you're doing nutrition, making the appropriate nutritional changes to help reduce inflammation, support the brain, and then also the supplemental support. So it's not like, I agree. What you said was a lot, and you don't have to take every single supplement that you just listed. You don't need to do every single somatic practice known to man, and
have
you don't
that
need
synergistic effect, though. You know what I mean?
You need to do all of those components together.
Yeah, those three categories.
My question is even for her. That's fantastic that she's weaned off and that she's almost there. Not Heather. We're very, very proud of you.
But you're not anonymous after all. You're not Heather.
But what I would say in this regard is, well, what brought you to that place of needing that in the first place? And let's make sure that we're addressing even environmental factors that contribute to this. How many of things do we even see regularly? We know that there's research and science correlated to certain bacteria that can increase mood effect and decrease mood.
And the inflammation.
And the inflammation correlated with that. We even know mold can be this. There specific Aspergillus penicillium can impact those with methylation impairments with the COMT that impact dopamine, norepinephrine, epinephrine. We know that this can impact serotonin.
What she's saying is that we look at genetics. Some people just genetically are more prone to these neurotransmitter imbalances. And then you have an epigenetic trigger like mold or a virus or a environmental toxin. And then that really overwhelms that slower gene variant.
Right. Yes. Sorry, I'll slow that down for you guys. No,
you said perfectly.
Yeah.
I just wanted to give people background.
I think too, even with some of the things that you're talking about, like supplements, it can be kind of daunting and overwhelming to figure out, well, do I just have to take all of these? But really, we can get pretty therapeutic even with the dosing, which is why I love that you mentioned like working with someone is so important here, because even with something like saffron's awesome when you're weaning off medications like SSRIs, because there are certain herbs and stuff sometimes that can be tough to use while you're on a medication like that. But saffron, you can actually dose really therapeutically, really high to help with that weaning process too. But you want to work with someone that's going to navigate that with you and find an appropriate balance.
That's a good point, because sometimes the suggested use on a bottle of a supplement isn't.
It's
just a general population. It's not for use for like a clinical purpose, which is what we're able to do when you look at someone's case and their health history and labs. We can dose it appropriately. And not everything can be dosed high.
Right. Yeah. Not everything. Right. So that's where working with someone, you can kind of understand that, because sometimes someone will start something and be like, oh, I don't really notice anything, but maybe there's dosage and some titration stuff that needs to be done there that could be really helpful, right? So, and then sooner or later you end up having a supplement graveyard, which we don't want that either.
Yeah.
So that would, I think, not Heather, you're doing the right thing. It sounds like you're weaning appropriately. But if you haven't explored, well, what was the reason we started this in the first place? If you haven't looked at the potential for environmental components that contributed to this, genetic history, all of that, you're on the right path. You've already laid the groundwork for us or another doctor that does what we do. But I would explore, like, long term. You sound young. I don't know how young you are, but you sound young. So you could easily be living another 40, 50, 60 years, 70 years, if you're in your 30s, even potentially. And what can we do to help you with your mental health for the next decades of your life?
Do you think we sound young?
I always feel like I'm an 80-year-old woman at heart. So to me, I sound
not like a feebleness.
Do you
just
sound
mean like
young?
an old soul?
Yes.
I think you sound young.
Really?
Yeah.
Well, I am young.
I think you sound pretty young. Yeah, I mean,
we're probably biased towards our own voices.
Please do not comment otherwise if you feel differently.
If you leave that in the review, I'm deleting it.
You will not win the free stuff, okay? All right.
That's funny.
Next question?
Yeah, let's go.
All right. This one is from Aspen. I love that name.
I have a question about sugar intake. So I know sugar is not good for us, but of course I do eat it occasionally. But I have noticed in the past maybe 6 months-ish, after eating sugar, whether that's like mixed with gluten or by itself, so I've tested that out a bit, I will get a sore throat, whether that is like a few hours later or like 2 hours later or the next morning, especially if I'm eating it at night. And I cannot figure out why this never happened to me before. I don't think my diet has changed or anything like that. I've never been a big sugar eater, but of course, like, I'm a baker, so I bake with it a lot. So yeah, I'm just not quite sure why that's happening. And I was curious to pick your guys' brains to see if you might have a reason why My throat gets sore every time I eat sugar. Thanks, guys.
Yeah, no shame, right? We all have some sugar in our life in different forms. Maybe some of us don't. Maybe some of us don't, but most of us mortals do. And then the quality of the sugar matters. The context of it matters. The bioindividuality matters. So we're talking about added processed sugar here, right? We're not talking about fruit. So let's just get that out of the way. There's studies that show that having over 50 grams of added sugar, not total carbs consumed, not total sugar from whole food sources. We're talking about 50 grams of added sugar is associated with a 2 times increase risk of bacteria that triggers recurrent pharyngitis, the inflammation, sore of the throat is what it was. Soreness of the throat is what she had. So sore throat, swelling of the throat, tickling of the throat, having immune system issues, sinus issues. We can kind of throw all that stuff in it because why? The sugar is feeding bacteria, different streptococcus, subcultures of bacteria in the nasopharynx area. Studies have shown that the more you're adding added sugar into your breakfast, lunch, and dinner and snacks and desserts and drinks, it's going to feed these opportunistic and pathogenic bacteria, which is going to shift inflammation levels in the body. And that's when you're going to notice these symptoms. Everybody has their own microbiome. Everybody has their own nasal, oral microbiome and their gut microbiome. And the foods we eat, not just sugar, but all foods, are going to modulate that microbiome. But specifically processed added sugar, not in its whole food form in fruits, with fiber and all the sort of matrix of minerals and vitamins, it behaves very differently. It's like a fertilizer for these weeds that can overgrow in the gut garden, these opportunistic and pathogenic bacteria. So I would be interested at looking at the oral microbiome from a diagnostic standpoint. I'd be interested at looking at the gut microbiome as a whole too. And so running salivary tests and gut tests, microbiome tests, can be really helpful at bringing in targeted either probiotics to regulate these opportunistic and pathogenic bacteria, or herbal antimicrobials to help prune this proverbial weed overgrowth, bacterial overgrowth in the gut. But there's studies that show specifically with these sort of sore throat symptoms that bromelain, 500 milligrams of bromelain, and up to 1 gram of curcumin, which is kind of higher dose, reduces swelling in the area. There's small trials to show that oral inflammation can be decreased with this sort of combination of bromelain and curcumin, anti-inflammation, right? Some other ideas that I like that we talk a lot about is gargling with salt water to be supportive. You can even do, depending on how systemic it is, do some nasal rinsing as well.
Yeah.
With either a neti pot or what are the other ones called?
Like a Navage system
Navage
or
is the word
nasal
I was-
rinse.
Nasal rinse, yeah. And Manuka honey. I mean, man, you guys hear me talk about Manuka honey. I love Manuka honey. Just a teaspoon first thing in the morning, straight up on the spoon. You can have it in other ways too.
What a great day to start your morning.
I know, seriously. It's like a little
How could you not have joy?
Pooh Bear diet. It has a compound called MGO, which is an antibacterial compound, which is good for the gut as in the immune system at large, but also topically in the throat can be good too. So those are some initial ideas.
So one of the things that I was thinking about when I heard this, that when we were listening to it, is, and I think of, again, doing this for almost 16 years, I start to think about past patients. But she mentioned just in 1 second that she's a baker. And so I think about the patients that have baker's lung. They have more eye irritation, more lung irritation, more. So she's inhaling some of these very inflammatory things like gluten. I don't want to demonize it. We're not going to hang our hat on this and say this is it. But let's just say if this woman does have some intestinal permeability or autoimmune pensions, like leaning towards that type of issue,
could really be aggravating it.
This could be a perpetual thing that's continuously aggravating her.
Yeah,
all the
Great
time.
point.
Yeah, I was
It's a clinical pearl there with her job.
And I was starting to kind of see or think about I wonder if she swapped out some of these baking items with more natural alternatives or just less inflammatory alternatives is what I mean by that. If she would notice a difference there too. But it's obvious that there's some resiliency or leniency that's starting to be lost a little bit because she said this never used to happen, right?
Yeah.
So to me, I'm thinking, okay, well, what is starting to add up that's causing that resiliency to be lost, right? Because she's even saying, I don't really eat that much, right? So, I mean, who knows? Even because
And
some
our
people
perception of much, though,
could
can
be
very different.
right? But at the same time, I can see what she's saying, where it's like, you know, this is like not really something that should be a big deal for me, right?
Yeah.
Like,
she knows her body, and this is something new.
right? Because even people like who have lost a lot of resiliency, then some can become sensitive to even more of the natural sugars too, like coconut sugar. Like they're like, even that doesn't work for me or whatnot. So I'm curious what else, you know, could have added to this over time. And that's where we have to start doing a little bit more investigation.
For me, the couple things that I would look at, Aspen, if this was me, and I would suggest working with someone, because this is your check engine light. This is your body telling you something is going on somewhere. One, your job. That is something we have to consider and think about, because you're talking about your throat and you have to think about inhalation. This is something that we see regularly. That, coupled with the fact that it's sugar in particular, speaks to a chronic infection of some kind.
Or overgrowth.
Or overgrowth. Like,
Dysbiosis.
right.
there's some sort of dysbiosis, chronic infection, something that's being fed every time you have this. Because you're right, you should have some resiliency built into that. And then I would be curious to look at the genetic components of it. Is there something that you just need more support so that you can build more resiliency in it? Like you mentioned, a lot of really great things that she can do. I think that's more of like a symptom management standpoint.
Yeah.
Right.
But we would want to definitely, Aspen, you want to nip this now before it starts to be a bigger issue down the road.
Testing could be very helpful here.
Yeah.
Especially, if we do this now.
Yeah, well, like Emily is saying, like, what is new now? Is it just the chronic exposure of something, or
Over time.
is there something current that she's going through now that's decreasing the resilience?
And
Right.
that could even be stress. That could even be mental and emotional stress. Like, are you, how many times do we see where nothing changed in someone's life, but then all of a sudden they're having to care for like an elderly parent and their immune system tanks?
Yeah, and people, when we talk to telehealth patients about this stuff, they typically know, oh yeah, I'm going through this right now and I never have been.
Right.
Yeah, and they may not make that connection on their own until
when
you
we
start
talk
asking
about
these really random, what feel like random questions.
Yes. Yeah.
But we're digging. How many times have we had a patient go, oh, you're right, that did happen around that same time that I had that surgery.
Yeah,
And
it's
I'm
like a light
okay.
bulb that kind of turns on and just brings awareness to it. So,
Yeah. Love it.
all right. Next question. All right. This is from Hannah. Say it with me.
Hannah.
Not Heather.
She's back.
Hi, Dr. Colin team. I absolutely love the podcast. My name is Hannah, and I
Thank
had
you.
a question about hypothalamic amenorrhea. So backstory is that I have a bit of a diet history, and when I have gone into calorie deficits the past 2 times, I've lost my cycle both times. The first time was in a really stressful season, and I was eating 1,500 to 1,600 calories a day. And looking back, it makes sense why I lost my cycle. However, the second time I ate at a maintenance calories of 2,072 for 4 months beforehand to prepare my body. Then I ate an average of 1,820 calories a day, prioritizing whole foods, nutrients, and so on. And yet I still lost my cycle. I'm not at a super low body fat percentage. I'm probably at the 24 to 25%. So I'm curious if you have any experience with why a woman would go through this aside from low body fat percentage, because it seems that that's everything that I see, as well as just too low of calories. So I look forward to hopefully hearing you guys answer this, and thank you so much.
Okay, so hypothalamic amenorrhea is basically when the brain, the hypothalamic pituitary ovarian axis, the HPO axis, the neuroendocrine communication line, the brain, the nervous system isn't speaking to the ovaries and the endocrine system at large potentially in the most optimal way. So suboptimal signaling from between the nervous system and the hormonal system. So she mentioned the maintenance dosage. I don't know exactly where she's at from a caloric standpoint.
She mentioned 2,072.
Yeah, let me back up a bit too. That she started the question with talking about her having some food
Diet history.
issues.
Yeah.
So I appreciate the transparency and the vulnerability of
Right.
sharing that on a podcast.
Yeah.
And wherever you're at in your recovery, I think working, what I have found great success with over the years is, depending on where they're at with recovery, is working with an eating disorder specialist and functional medicine combination.
Yes.
Right.
And sometimes the EDS, like the eating disorder specialist, isn't needed on a regular. If they're already well on their journey, you may be already in a maintenance phase with an EDS, an eating disorder specialist. But maybe you're not, or maybe you see a relapse of something. Then reach out to a specialist that's informed in eating disorders, and we can come alongside for sure. And we have mental health, emotional health components of what we do. We talk a lot about on the podcast. So this is something that's there, but sometimes they do need most of the time, they do need some added support. So it's a both and, not either or approach.
Yeah.
And we'll get on the same page. We set up conference calls with the eating disorder specialist.
Yes, we do.
And so we're all on the same page. You're not hearing different opinions. You're like, we're all there to help you and heal you. I would say, if I had to take a guess, it sounds like Hannah is further on in her journey and is aware of that and is in a healthy place, but she's dealing with this physiological stuff that's there. That may have been ramifications of years of eating disorder. Certainly can happen. But studies show that if you're at 300, on average, a 350 calorie surplus, it has a pretty good success rate. It's like 60 to 80% bringing back the period in a period of 1 to 12 months. So within the first year, if you have on average, a 350 calorie above energy expenditure surplus of calories, it has a 60 to 80% success rate in RCTs, in randomized controlled trials.
Wow.
So pretty successful. It's going to take time, and obviously the quality of those calories matter.
Yes.
Not just calories for the sake of it, which is, I think that's the rub sometimes with eating disorder specialists.
Yeah.
Right.
And
Functional medicine.
Functional medicine, and people that are informed in health and not just eating disorders. You need a both and approach. There's a lot of wellness informed eating disorder specialists out there.
Yes.
And that's the type that we like to work with. It's like, okay, the quality matters, not just calories for the sake of it.
Yeah, we don't want to send someone to Dairy Queen who's also having major health crisis.
Yes. And you can be in a restrictive eating disorder past, but trading one problem for another
Is
and
not-
dysregulating the gut-brain axis and perpetuating mental health issues is not the answer.
Correct.
And so I think that there's a middle ground that we have to strike and find, so you can build mental health and body health over time, because it's one and the same. So there's different peptides that can be really good. Semaorelin, CJC can be really good. Basically, pituitary peptides, things that work upon the pituitary glands, can be really good. A lot of success with that as well. And looking at the stress part, going back to the therapy part of it. She mentioned going through a stressful time of her
Yes,
life.
Right.
That was one of the times she first lost her cycle. I also have to think, we want to think about gut health, because even though you can be completely asymptomatic in your gut, meaning you're not dealing with bloating or pain or, diarrhea or constipation, it's where a large portion of hormone conversion, storage, and production takes place. And so even though we're talking about the brain, there's the gut-brain axis, gut-hormone axis. So it's one of those things too. It's like, well, Hannah, is there something else going on too?
Right.
Like beyond just the history, or even if with these times of caloric restriction, intentional or non-intentional, because like what if someone doesn't have an eating disorder, but they're very stressed, and she mentioned that, and she was going through stressful and started eating lower calories, and she lost her period. Well, was it just the calories, or was it the stress on the body that also caused the loss of the cycle?
That's what I think a lot about. Like, I was just thinking of like her nervous system, and because when that gets dysregulated, and we know through stress, trauma, but even biotoxins, pathogens, like that dysregulation is going to have a huge impact. And just even our experience, that's something that we majorly work on with our patients.
Beyond just calories, what about macros? Are we having enough protein? Are we having enough? Because like, are we having enough healthy fats?
Enough
are there?
carbs.
So it's when I hear someone being so specific about the amount of calories that they're having,
it makes me nervous.
It makes me nervous.
There's a fine line that we have to kind of balance.
I actually feel like I can feel the tension in my chest hearing her talk about it.
Because people that are so hyper-focused, and they could be well in their healing journey, and then you trade restriction with orthorexia.
Yes.
And it becomes this sort of hyper-focused which is disordered eating or unhealthy foods. And then they're bringing that calorie counting mentality to wellness.
Yeah.
Right.
Which is needed sometimes, but it is a delicate line.
I think it just goes to show this is not a one size fits all approach, right? There are going to be people with a eating disorder history where they may be in a mindset where we have flexibility to focus a little bit more on this. And then we've had people where it's like, hey, we don't even want you to food log, right? Like you need to be able, and what we've found is that we have to be able to pivot and also recognize too, like when we're talking with someone, we have to recognize if, hey, maybe this isn't the best step for us to take because they may even say, I don't know if I can handle food logging, right? Like you need to find someone that can pivot with where you're at. And sometimes we see people, I know we talk about this a lot, who they're not aware. No. They're not aware of, even though they're working with someone, they're still not aware of like how maybe easily triggered they could be. And they're all up for it at the consult. They're like, I can make any changes. I can do this. I can do that, which I love that. I think that that's something they genuinely want. But then we start getting started and they're like, whoa, this is way too much.
Yeah.
And
then we have to pivot.
Or we see it even the opposite. We give them it and then they become so strict. It becomes like their Bible. And we're like, no. Like this isn't healthy. Like we've just switched, like you said, one issue for another.
Yeah. And we end up loosening things up. Based on
if I see someone doing that, that's one of the first things that we do is like, okay, nope.
You're overcorrecting.
We have to pay attention. Yeah. It's so important. So
because there has to be a grace and lightness to all of this. So the stress around the healthy thing isn't good for your health. No. So if it's impacting your stress levels at all, we need to be, and that's why I call the podcast The Art of Being Well. It's like the art of it is saying, in theory, this may look and make sense, but you're not a calculator. You're a chemistry lab. You're a human being. You're a soul that needs like some ineffable flexibility there based on what we're seeing.
Yeah.
So some herbs that can be beneficial here, things like dong quai, chaste tree extract, red raspberry, Chinese peony.
Yes.
We have a hormone stack.
Balance.
I was just going to say balance.
Well, we have a whole stack. We have balance,
we do.
protect, which is liver support. You have to clear out hormones, excess hormones, and environmental toxins that can be endocrine disruptors. So it has balance, protect, ashwagandha, which is a favorite, like very well researched adaptogen, and it has chill in it, which is GABA-energic. It supports the parasympathetic because when the body's stressed, you're really shutting down hormones.
Exactly.
That fight or flight response, hormones are going to take a back seat. So that synergistic effect of female hormone support, which I mentioned, the chaste, the vitex, the dong quai, the red raspberry, the Chinese peony, and other cofactors, methylation support within that. So there's that. And then there's liver support. And then there is the ashwagandha, the adaptogenic support, which supports the hypothalamic pituitary ovarian axis modulation, the neuroendocrine modulation, to help with the the communication line, and the GABA-energic support, the parasympathetic support, which has L-theanine, GABA, and not myoinositol.
Yeah, it's amazing.
So that combination is if you're not a telehealth patient, that's why we put that protocol stack there. It's the art of being well. Just go to the shop and go to the hormone support. So a lot of the listeners that aren't telehealth patients, which is most of you, we only have so much room. You can do that on your own and start there. And if you need labs, you may need labs. Then reach out to us.
Right.
Then reach out to us. And then there's sermorelin and the CJC peptides, which, look, the accessibility of peptides isn't the best. But in theory, certainly if you're working with a functional medicine doctor, peptides could that work upon the pituitary gland is definitely what we need.
And just from a food perspective, I know we mentioned it ever so slightly. I understand you're counting your calories, but also be looking at the macros of that too. I think women vastly are notorious for undereating protein and healthy fats.
Yes.
And those are going to be very, very important when regulating hormones.
Absolutely. Yep. I had an episode that it's actually, when people hear this episode, I'm just thinking of the timing of this. When people listen to this episode a few weeks prior, this is perfect timing. I actually didn't plan this. Go back and listen to a recent episode that I did with Lily Nichols who's
Yes.
a dietitian,
Yes.
talks all about female hormones. She's talking about it mainly around fertility.
Yeah.
But fertility is just a woman that, for women's fertility, it's just about a woman that has
Optimizing
hormonal
hormones,
balance.
yeah.
So
Yeah.
you don't have to
Optimizing
be
hormones.
trying to have a baby. You could just
Yeah.
want to have a normal period, right? A normal female
Yeah.
hormones.
She's brilliant. Yeah. That's
So
a great
Lily
episode.
Nichols, yeah. So preconception, pregnancy, all of it. We cover it. We cover it in that episode. Really good timing there.
Yeah.
Maybe we'll put it in the show notes if we can.
Cool.
All right.
show
Awesome.
notes.
All right, Dr. Cole. Last question is going to be from Lauren. I'm going to play it.
Hi, my name is Lauren from Minnesota. So I have had Crohn's disease for about 10 years now. And when I was first diagnosed, I got put on a biologic, and I have been ever since. 2 years ago, I had a colonoscopy, and it showed complete remission. And in the last year, I've been working with a functional medicine doctor, and I have been doing numerous stool tests, oat tests, and addressing any remaining issues that I have. I've cleaned up my diet. I'm gluten-free, grain-free, dairy-free, sugar-free, just trying to heal what I believe I had leaky gut all those years ago. And my question is, my GI doctor doesn't seem to care that all these markers have improved. He thinks I will be on this drug the rest of my life, and he won't consider going down in dosage or spacing out my dosage. My question is, have you ever seen a patient successfully get off a medication like this with an autoimmune disease after healing their gut and doing lots of work over the last year? I feel like I'm on my own in this, and I'm just going to have to go against what he says eventually if I choose to stop the medication, because even if everything is showing complete remission, he will not accept getting off of it. I would love to know your thoughts. Thanks.
Well, the short answer is yes, it's absolutely possible to get off of a biologic or steroids or immunosuppressants, whatever we're talking about. And, but that's possibility, right? I don't know your case. I don't know the specifics of it. And so I can't speak on it's specific on your case specifically. And I would kind of pair this similar concept to the antidepressant, right? It's like you're going to want to work with a doctor that's working on titrating these immunosuppressants, steroids, biologics down over time. Typically is not cold turkey. The immune system's been, for lack of better words, shoved down, suppressed for a while now. And that is certainly an aspect to why you're having the remission, is because the medication's doing what it's supposed to be doing. But some people don't want to, many people, and understandably so, don't want to be on these medications long term because of the potential side effects, and they have been working on their health. So this both and approach is typically where we are meeting people. They are on pharmaceutical drugs, they're looking long term and saying, why do I have this problem in the first place? So over time, I can see what my body can do on its own, and look at the very least, I could decrease the dosage, like you said, spread it out, lower the dosage. Like, is there a middle ground of maybe not coming up entirely? But what is the body capable of? Maybe the possibility is entirely off. You have to see how much wiggle room and resilience you have over time. And that's what that titration process looks like for somebody with inflammatory bowel issues or other autoimmune issues where they're on medications. Look, we have to deal with what's causing that molecular mimicry. In this case, when you have inflammatory bowel disorders like ulcerative colitis and Crohn's, something is dysregulating the immune system. So from a differential diagnosis standpoint, we have to look at health history. We have to look at labs, because it's things like chronic infections in the gut, different bacteria, parasites, viral issues in the body, mold toxins, the biotoxins, because almost I would say almost all people with autoimmunity have different HLA gene variants. The majority, I should say, have HLA gene haplotypes that make their body more sensitive to bacteria, virus, and mold. And then on top of that, we have to look at the category of environmental toxins as a whole that could be triggering some genetic predisposition for autoimmunity. And then stress and trauma. We have to look at the chronic stress trauma piece. All of this stuff is well documented in the scientific literature. It's just about looking at what are your pieces to your puzzle.
Exactly.
Because you don't necessarily have all of them, but we have to look at what's causing that tipping point to be had, and then emptying that proverbial bucket so you have some wiggle room. But when you empty the bucket, then remission is possible without the medications over time.
Yeah, and because I mean, I love all that she's doing, right? She's, gluten-free, grain-free, dairy-free, sugar-free. Like, you're doing so many good things, but ultimately the food wasn't the problem. It's the exacerbator. It obviously still stressed out the gut, still stressed things out. But I think we need to look at where these things started, so that way you can, again, address it from the root too. And so I think that that's going to be an important part of this. And then from there, as you address it, I mean, I think that there is room to see, all right, what resiliency has really taken place at this point.
I think an important note is, Lauren, you mentioned that you've been doing this for the past year, but at the top of your question, you mentioned you've been dealing with this for a decade. So a year may feel like a really long time to be making these changes, and that does not diminish what you have done.
Right.
You've done an amazing job. However, you had a decade of dysfunction, and that's just when you were diagnosed. We don't even know how many years leading up to that. So a year may feel like a really long time, and and I understand your frustration with your doctor and not feeling like he's on, I think you said they are not on board with the decrease of medication. One, if you don't like your doctor, find a different one.
Yeah.
Advocate for yourself. That's okay. But two, also from a perception, when someone has maybe been working with you for a decade and they saw how sick you were at the onset or at the start of the diagnosis, and then it continuously, they've monitored and been able to manage and get you better under control the last decade of your life. And then within the last year, you made changes. There's not been enough time. And I think that you're doing the right things. I think you have the right attitude. I think it's okay to advocate for yourself. I think there's a right way to wean off things to see if you can. But ultimately, this is probably a decade plus of things that have been going on. And we'd want to explore, like Emily and Dr. Cole both said, we'd want to explore, well, what started 10 years ago when this all happened in the first place?
Exactly.
And these changes that you've made, are they things that you have to continue for the rest of your life? Is there any room to build in resiliency so that you don't have to be as strict or stringent on what you're doing? I think there's a lot of questions to be had. I think at the base value, I do want to say, there is a lot of hope. We have a lot of patients that were told, you're going to be on this medication for the rest of your life. You're not even going to feel better. You're just going to manage your symptoms for the rest of your life. And we've seen that to be categorically untrue in most cases, that there is at least room for improvement at minimum, if not complete remission.
Yeah.
Well, yeah,
absolutely.
They're not even willing to decrease the dosage. It's like,
Yeah.
to me, it's like to Andrea's point, I think that some great insights. It's like, I would find a doctor that's at least open to starting there. I mean, that's pretty conservative to
or
say,
even
like, just decrease the dosage.
Right. Or even just saying, hey, I think it's too soon, but, let's talk about
here's the plan.
this, right?
Well, let's do this another year, and if these markers still look good.
This is the behind the scenes for most conventional doctors. Unless they're naturally open-minded and curious about these things, or they've done postdoctorate training in functional medicine and actually are in our space, which most of my colleagues are conventionally trained, but are trained in this as well. If they're pure orthodox in their thinking, it's not anything personal. They just don't understand. Like, their wheelhouse is this.
Yep.
So they're not looking at a lot. Now, it's becoming increasingly less common for conventional doctors to have not seen what's capable within functional medicine, because we've taken a lot of ground over the past 15 years.
We're getting loud.
Yeah, we're getting.
Yeah.
So most people, doctors, because 15 years ago, people would be like calling like crazy, like they did not understand what we were doing. But now it's like, okay, what we typically hear from telehealth patients is from their conventional doctor after they've improved their health, they've healed, their labs are improved, their symptoms are improved, they're able to reduce their medications with their doctor, their prescribing doctor. Their doctor says, whatever you're doing, keep on doing it, because they don't necessarily understand it. But the labs aren't lying, their symptoms aren't lying, and that prescribing doctor is at least willing to say, what does this look like while being properly monitored and managed, but what does this look like with less dosages? And then over time, seeing what decrease, what does that tapering look like for that individual? So yeah, those are some thoughts there.
Yeah, and just a clinical insight too for this, Lauren. Your gut takes time to heal even if you're feeling better. Some of our most, I don't want to say difficult, but I'll just use that word for a lack of a better word. Difficult patients are the ones that actually feel better after 3 weeks. And they're like, can I go back to doing what I was doing? And I'm like, no. Like, I'm so glad you feel better, but we're not there yet.
Let's keep going. Yeah.
The gut can take upwards of 18 to 24 months to heal under the best of circumstances.
With someone with IBD for sure.
Yeah.
Right.
Yeah. So and I'm just talking about one instance, one case, just to help you understand that feeling better is a great first sign, but there's still work to be done.
Oh yeah, for sure.
Yep.
Yeah. There was something else I wanted to say there, but I think we covered most of it.
Yeah.
Yeah. So I would definitely look at let's reach out to us and have us look at some labs and see what is the body capable of over time. And then similar to my thoughts on the mental health side of things, are there things that are immunomodulating or anti-inflammatory that are stabilizing to the body, like peptides comes to mind, something like BPC 157, things that support lowered gut inflammation while you're tapering off. KPV, yeah. Great.
Combination of those two.
Yeah. Is that all we have?
That's all we got for today.
That's it.
All right, guys. If you want to learn more about our clinical work, the telehealth center, there's lots of free resources there as well. Check it out at drwillcole.com. We'll see you next time.